This is Lindsey Thomas, and I am doing my IM and sub-Q injection simulation. The first thing I'm going to do in the medication room is verify the physician's orders. The doctor has ordered 4,000 units of heparin sub-Q every morning and 25 milligrams of Phenergan IM every as needed for nausea. I am going to check for lab results pertinent to my medications. So that would be the PTT for heparin, and everything looks good. There are no lab results for Phenergan. I'm also going to assess my patient Kelly Jackson's medical history, her medication history, check for any known allergies, her height, which is 5'6", her weight, which is 250 pounds, and her age, which is 35. Her date of birth is 1/1/1985. All right, I'm going to wash my hands and pull the medications ordered. I'll do my first check of the MAR now, and I will check the integrity of my medications and their expiration dates. The heparin appears to be in good condition, and the expiration date is 4/2021. I am also going to check my Phenergan, which it appears to be in good condition, and the expiration date is 4/2021. So now I'm going to drop my medications and do my second check of the MAR with my syringes and my needles, my vials, and the doctor's orders. The order was for 4,000 units of heparin, and the available is 5,000 units per 1 ml. So I will be giving 0.8 ml of heparin. And the order was for 25 milligrams of Phenergan, and the vial available is 25 milligrams per 1 ml. So I will just be giving 1 ml of Phenergan. I am using a 1/2 inch needle for my heparin and a 1.5 inch needle for my Phenergan. All right, so I'm going to prepare both of my medications. I will do my heparin. So I am going to cleanse my vial. I will draw up 0.8 ml of air into my syringe. I will inject the air to pressurize, and then I'm going to draw up 0.8. Recap, and that is my Phenergan. All right, so I've got my 1.5 inch needle for my Phenergan. I will cleanse my vial, and I'm going to, draw up 1 ml of air. I'll inject that air into the top of the vial since my needle is long. And then I'm going to draw up my 1 ml, make sure I don't have any bubbles. Okay. So that is my Phenergan. I am going to discard this needle into the sharps container and change into a sterile needle. I'll just do it right from the package so I don't compromise my sterility. And my Phenergan is ready to go. Now I'm going to gather all my necessary equipment to go to the patient's room. I've got my syringes and my needles. I have my 2 medication vials. I've got my alcohol prep. And I've got my gloves. I have my physician's orders. And I've got my MAR. Okay, so I'm going to head to the patient's room. I'll introduce myself. My name is Lindsay. I'm here to give you your medications that were ordered by your physician, your heparin and your Phenergan. I'm going to wash my hands and identify the client with 2 identifiers. So I've got Kelly Jackson here, date of birth 1/1/1985. At the bedside is where I'll do my 3rd check of the MAR. So I'll compare my MAR with my syringes and my vials, my 2 vials, and my physician's orders. I am going to loosen my caps. All right. So I'm going to ask my patient to check for their orientation. So I will ask them if they know where they are and what the date is. I'm going to also ask if they have any known allergies and what their knowledge of the medications are, and inform them of, if they don't know, Phenergan is for their nausea and heparin is an anticoagulant for preventing blood clots. I'm also going to ask the patient when their medication was last received and where the medication was last received, so that I can rotate the site. I'm also assessing for their level of consciousness, their ability to cooperate with me, and I will delegate assistance with positioning if necessary. So 2 sites for IM injection would be the ventral gluteal. So that is at the anterior superior iliac spine. I will place my palm on their greater trochanter, my thumb towards their groin, my index finger at the iliac spine, my middle finger toward the iliac crest, making a V, and this is where I'll inject into the center. Another site is the vastus lateralis. It's on the lateral thigh, 4 fingers below the greater trochanter, 4 fingers above the patella, and I will inject into the middle third of the lateral side of the thigh. All right, so I am going to put on my clean gloves. And I'm going to assist the patient into a comfortable position. All right. I am going to inspect and palpate for bruises. I will remove my needle cap. I'm going to pull the skin. Oh, hold on, I don't want to do that yet. I'm going to pull the skin taut for a Z-track method. I will cleanse the site from the center outward, let that air dry, and then I will remove my needle cap. I'm going to inject at a 90-degree angle, stabilize with my other hand, and slowly inject the medication. And I'll leave here for about 5 seconds to make sure that the medication is administered. I'll remove my needle and discard it into the sharps container and grab a gauze, apply gentle pressure. All right, and put a Band-Aid over the site. The next, my sub-Q injection. I have 2 appropriate sites, would be the 2 inches to the left or right of the umbilicus, or the upper lateral of the arm. So I'm going to assist my client into a comfortable position. I will inspect and palpate for bruises. I'm going to cleanse my site from the inside out and let it air dry. I will remove my needle, remove my cap from my needle. I'm going to pinch my skin. I'm injecting at a 90-degree angle because my patient is 250 pounds. Stabilize my syringe. And I'm going to inject slowly. And leave the needle for about 5 seconds. I'll apply my gauze, and then I'm going to discard my needle into the sharps container, applying gentle pressure with my gauze. Now I'm going to clean up my patient and the area. I'll assist them into a comfortable position. Take off my gloves, wash my hands. I'm going to put the bed down, put both the side rails up, and I'll place the call bell within reach. I'm going to assess both of my injection sites for lumps or tenderness and swelling. And I will also ask the patient if they're comfortable, if they're in any pain, if they need anything, need to go to the bathroom. And then I will document and report my procedure and my client's response. And that is my IM and sub-Q injection simulation.